So finally, in our collaborative today, I'd like to take the opportunity to again introduce Chris Mundorf, our Director of Data Analytics and Reporting at Better Health Partnership. He's going to announce our Better Health Gold Stars, which is something we've been doing as long as we've been having learning collaboratives. I will give my own perspective on this about what a strange year it's been. Of course, it's been more than a year that we've been all undergoing the effects of the pandemic. Um, this had an impact on patient care. This had an impact on the health of our patients. This had an impact on the health of our caregivers as well. Part of my work at Cleveland Clinic over the past year and a half has been in terms of managing the health of our caregivers who have been affected by COVID. So all of these have combined in this perfect storm to add to the difficulty of making health improvements in our systems. So I will say, Chris will tell you more about this, but what a great opportunity it is to look at the larger picture of really what improvements have been made. How can we frame the health improvements in the time of COVID and really celebrate the work that's been done, which has been phenomenal. You know, we think back to the earlier discussion about the work that we did in terms of COVID testing, COVID vaccination throughout the community. This has had an impact on all our areas of healthcare. And it's hard to lift our heads from the work sometimes and take a moment to really recognize and celebrate. So I'm really grateful to Chris for putting this together. And Chris, I turn it over to you.
Thanks, Donald. That's a really nice framing. Yeah, I think it's really important with this learning collaborative, so much discussion is talking about, the layers we're adding on to this quality improvement of, racial and income disparities, behavioral health, community engagement, climate change. And I think it was really important, Dr. Boland's sort of talk at the very beginning of that core idea is that chronic disease measures. And I think it's still so central to what we do. And as Dr. Ford described, I think that it's so much hard work is being put into across all the systems, in and out of our collaborative to really help, improve care for the patients across Northeast Ohio. Next slide. So as Donald described, traditionally our role as a regional health improvement collaborative first started as this effort to aggregate data across health systems and look for promising best practices across the region. And the tool that was used to identify those practices early on and continues to today are these gold stars. These are methods we use to highlight practices in the collaborative that are either showing tremendous improvement year to year or showing tremendous achievement in key metrics that we selected as a collaborative, metrics of colorectal cancer screening, the care of patients with diabetes, or the care of patients with high blood pressure. Next slide. So as an example, our most recent report, just as the pandemic was starting for 2020, these are two examples of gold stars that we found. And what I really love about the process is that it's really it's blind to the size of the practice, that we're not only able to find best practices at these large hospital systems, but we're really able to find best practices that are occurring in smaller practices, particularly federally qualified health centers that are disproportionately serving the low income and minority populations and doing a really amazing job of that. So on the left, as an example, we look at practices using data as a whole, their entire patient population. And so we see the red circle is the Akron practice for Asia Inc., serving in down North Hill in the Akron neighborhoods, doing really, really well compared to the region in the care of patients with diabetes, doing quite well. Additionally, on the right is an example of how we look deeper in the data. We also look at the data broken down by the person's insurance. This really helps us to understand, specifically looking at people who lack in health insurance, those that are on Medicaid, those are on Medicare, things like that. And the example that I wanted to highlight is, looking at colorectal cancer screening among patients on Medicare, that the Superior Health Center associated with Neon, serving, east side of Cleveland, is getting an amazing 80% of its eligible Medicare patients screened for cancer, and it's higher across the region. So really remarkable work that we, it's really sort of this, it's a pleasure whenever we disseminate these gold stars, because on the other end, it's usually these practices really doing hard work that oftentimes isn't getting recognized. And when we are able to sort of disseminate these gold stars, it really sort of validates the work that they're doing behind the scenes. But as Donald described, this past year and a half has proved challenging to do our typical gold stars. There's been a huge disruption, as Rita and I showed in several slides ago, of people getting their typical care. And then on a data side of being able to get consistent data, that we're actually able to get a clear picture of gold stars. Yet, so we wanted to do something to highlight the work that was done. And one way that we all settled on that we thought would be interesting would be to look back at all of our gold stars and see what we've been able to tell about the nature of sustained success. Because it's one thing to be able to show this high level of sort of success over a 12-month period, but what does it mean when a practice is able to do that year after year after year? And how can that in itself be a best practice? Next slide. So here are 3 examples that I think really kind of tell the story of what that means. So on the left, we look at high blood pressure care, as a metric, and really consistently, year after year after year, almost as long as we've been doing gold stars, the Sisters of Charity Health System, St. Vincent, has just really outperformed the region year after year, consistently, really, hitting that high level mark, time and time, whatever turnover we might be talking about in terms of staff, providers, or patients, that they're able to hit those marks time and time again. In the dark blue, we have the Glenville Community Center out of Metro Health, formerly J. Glenn. And when we look at colorectal cancer screening, consistently outperforming the region, over the last 5 past years. And on the far right, we have an example in the Willoughby practice that was once a part of the Lake Health System, now part of the University Hospital Systems. And over the last 3 years, 6 reports, they've been far outpacing the region in terms of diabetes care. And in fact, this past report, their metrics were about 40% higher than the region as a whole. So not only in terms of consistently outperforming the region, but doing so at a very dramatic level. Next slide. So looking at other examples of these, I need to come up with a better name, reoccurring gold stars. I was surprised to find that, there were a number of practices that have met this sustained high level of success over many years. In fact, we have over 20 practices across our Better Health Collaborative, really kind of hitting this mark of hitting these gold stars at 80% or more of the metrics they've sent it in. These range from large practices like the Louis Stokes Wade Park practice with the VA, the Metro Health main campus, to smaller practices at FQHCs like the St. Clair Clinic at Care Alliance, the Detroit Shoreway Community Health Center and Neighborhood Family Practice. I look across this and I know a lot of the providers that work through these practices. And it's a major accomplishment when you consider how often the turnover looks in terms of losing staff, losing providers, and then also the changing demographics of which patients come to these practices. The fact that these practices have been able to sort of have sustained this high level of success over many years is a reflection of sort of that core culture that these systems and these practices sort of sustain. So hopefully, as we move past the pandemic, we'll be able to get people back to seeing their provider and use the gold stars to highlight the promising practices. But in the meantime, hopefully this analysis can help to rightly praise the many men and women who have worked hard to achieve high levels of care and sustain that care over many years. And over the next few weeks, Better Health Partnership will be doing more to highlight these individual practices and releasing more data and details over just how these sites were able to sustain these success. So I hope that ends on a sort of a positive note, but again, so much hard work is done behind the scenes, and we wanted to make sure that we expressed our gratitude and the recognition to these practices and all the systems that are part of Better Health Partnership that have worked so hard to sustain high levels of care during this tough year and a half. Goodness gracious.
Thank you so much, Chris. I find that to be a tremendously positive note. even to take a moment to pause in our exhaustion from this pandemic, to recognize each other, recognize the hard work that is being done, recognize the successes that we have. Thank you so much for delving into the data to find those wonderful examples of success. We've come to the end of our learning collaborative. We've had, I think, quite a journey today. We started with Dr. Boland talking about the accomplishments and importance of our collaboration with a statewide organization addressing disparities across the state, learning from each other, exactly as we do in Better Health Partnership, learning how we can expand these efforts and be part of the larger whole. Our panel discussion about the Woodhill neighborhood transformation was, for me, transformational. I can't tell you how heartwarming and heartbreaking the conversation was to me, to understand the need, but the efforts that are being put forward, pulling our community together, the tremendous spirit of all of our participants. And I think we all responded to Ms. Marilyn and her passion for the community and her dedication to her home. Let us be an example to the larger community of how we can institute change and make it sustainable. The talk from Rita and Chris about the larger efforts of Better Health Partnership, showing our extensive areas of collaboration, our partnerships, how we've relied on our partners to inform us of how we can do better across the system, how we've constructed groups to address the individual problems, drilling down from an understanding of the needs of the larger community to actual tools that we can use in our practices to make our care better, to fill those gaps, and to include those who have historically not been included. The work with COVID is, something that we should be infinitely proud of. I think we can celebrate our own participation, but I think as we hopefully look forward to the end of this pandemic, or to at least a way out of this pandemic, we know that we've contributed. We know that we've made a difference to the most vulnerable in our communities. The work of the adult leadership team, I find really impressive, because what you did for us, Jim and Mimi, was you really broke down the process of how do we address these things, from everything from how do we put a group together to how do we start to formulate an idea, how do we understand the problem, a problem so large as racial disparities in chronic disease management. We've impacted it before in Better Health Partnership, and yet we've needed to take this step back, as you are doing so diligently, to try to really understand what's missing. Why haven't we sustained that? Why did we achieve those improvements, and yet we're not able to sustain them in the way that we think we should? The whole discussion on climate change and health. Again, this is an example of a huge problem that's bigger than any of us in this in this Zoom meeting today, and yet people in our organizations, people in our communities are addressing these, starting to develop tools so that we can actually have an action about addressing this huge problem. I thank everybody who participated today as a presenter. I thank everybody who stayed with us to listen in the audience. I thank those who all contributed thoughts in the chat. And I am really happy to leave this organization from this role on such a high note. My heart is with you always, and I continue to collaborate in many, many ways. I thank all of you for putting this work out and making such a difference in our community. Rita, any closing words from you?
I could never say it more eloquently than you, Donald. So I'm not going to try and take that place. But thank you for all the work you've done with Better Health Partnership over the years. And certainly anyone can see how well you MC these events. And I really don't know who is going to fill those shoes. So thank you. But thank you to everybody. Phenomenal collaboration today. And I really look forward to seeing you all in person next year.
And of course, thanks for Carol for being the organizational spirit of this, and to our partners at Civitas as well for driving this through and providing a safe and healthy environment for us to do this in. I wish you all the best and have a beautiful weekend.